20 years ago, this 54-year-old lady had a mole removed from this area on her left upper arm. There was a residual pink scar until around 2 years ago it started developing a slowly enlarging brown area. My colleague sent some photographs to Telederm, who rejected them because they were poorly focused and requested more, including dermoscopic images. He therefore brought her to me to have these done. What do you see and what do you do? Using our ABCDE criteria for a potential melanoma, it's a concern. However, the border is quite well demarcated. It's flat-like and the surface slightly rough to touch. Is this a seborrheic keratosis? However, dermography isn't like that of a seborrheic keratosis at all. There's no white linear flashing up. There's no fissures and ridges pattern or hairpin vessels. Is this a bit of pigment network pattern making this a melanocytic lesion? Is this some negative network? The vessels are of the dot variety and patchy throughout the lesion. Some brown globules here. Well, are they corridor-like openings, I wonder? I couldn't see any shiny white structures, but this could be a small patch of progression maybe. There's no atypical network pattern or blue-white veil that we can see in some melanomas. I wasn't convinced it was a seborrheic keratosis, but took some photographs for my colleague to send back to Telederm for their review. Didn't see their reply, but here it is. They were reassuring. Fortunately, I was concerned and interested enough to put this lady in my own follow-up diary for a review in 3 months' time, at which time I texted her and she said, "I've been reassured, but has changed some more." Alarm bells started ringing. I smudged her in to see me later that same day. Here are the images. What do you see now? There's a much clearer focal patch of negative network pattern here. There's more dark globules which are ultraviolet light and don't light up like corridor-like openings in seborrheic keratosis often do, suggesting these are true nests of melanocytes. The dot vessels are less prominent, and the white patch is more obvious, and in parts I thought there was some fine peppering of pigment, very different to the coarse pigment seen in lichen planus like keratosis. I'd seen enough and quickly pulled the trigger for a 2-week referral on the calcium pathway. It was duly excised, and here's the histology. It was an in situ superficial spreading melanoma with regression areas, and this should be cured. However, I consider this a near miss. This sleeping lion was caught before it woke up and started biting deeper into our patient. My question to you is this: do you have a good system to follow up patients you aren't 100% sure about? If not, why not?